Any woman who works in this organization has their head held high. All the corporate hospitals are getting into it. There are hospitals where I have visited which have a suite room tariff of 2 lakhs per day.
How important is it for a doctor to get emotionally attached with his or her patient?
Because we belong to an industry where there is so much of negativity. There is hardly any happiness. They see deaths happening every now and then.
Namaskar, you're watching Swasthya Sambad. My name is Ranjan Das. Today with us, we have a very special guest. With us, we have Miss Nilanjana Mukherjee, the Vice President and Unit Head of AMRI Hospitals in Bhubaneswar. Ma'am, welcome to Swasthya Sambad. Ma'am, the first question that I want to ask you is, you have been in hotel industry and now you're in hospital industry. How has been your journey so far?
Hotel as well as hospitals are a hospitality industry, and today the patients who come to the hospital, and especially to the private corporate hospital, which I would say are at the 4-star or the 5-star level, their demand is as equivalent to a hotel guest. But my journey from the hotel, where service and the wow service as we call was our forte. Hospital, you get to meet people who are not in pleasure. They come to you because they are in pain. So with the wow service and with the kind of high quality service, you also have to add in a little bit of empathy and sympathy. Along with that, a lot of statutory compliances are also mixed in a hospital. So my journey from the hotel to the hospital has been a commendable journey. What I have learned from the hotel is the standard, because I have worked in Taj group of hotels. So to bring in that standard with the kind of medical care which we can is a mingling of both. Like today, if you come and see our suite room, it is as good as a Taj suite room. But the difference is you don't have a healthy man, you have an unhealthy person there. So that is the difference. So this is the journey from there. Now, if you ask me, we get lot of employees from the hotel industry in the hospitality level. I have my facility head who has come from a hotel industry. Because what happens is when you are going into a room, when you are actually making a room, we call it finesse. You know, the actual finesse of a room will be understood when you are working in a hotel. Like even a furniture placement is very particularly strategically placed. So that is what we are getting into. And all the corporate hospitals are getting into it. There are hospitals where I have visited which have a suite room tariff of 2 lakhs per day, 3 lakhs per day. So you can imagine that kind of demand is there. And yes, unlike hotels, we also have to demand, keep up with the demand of the doctors and the clinicians. So that is the thing.
Ma'am, the next question that I want to ask you is, I want to understand that what are the biggest challenges as far as hospital operations is concerned?
The biggest challenge which I have faced as an operations head as well as a unit head today is balancing between the need of the patient and the need of the doctors. So I have always believed that patients are our customers, but doctors are also our customers. Why we say that is because unless you give the doctors the comfort to work, you don't give him the support to work. End of the day, he will not be able to do justice to your patients. And end of the day, he is statutorily compliant and ethically compliant to save the life. So my journey as a unit head in this hospital has been to ensure that my doctors are very comfortable. Yes, there are nursing staffs also which need that kind of a compassionate. So one challenge is balancing between the patient's need and the doctor need. And the second biggest challenge which we face is to keep the entire staff motivated, because we belong to an industry where there is so much of negativity. There is hardly any happiness. They see deaths happening every now and then, right? So keeping a staff in a positive mind, in a very energetic mind is another challenge which the industry faces. So that is again another challenge. And the third, which I would like to really emphasize, which through your media, if we can, educate, is skill development. This industry needs good skilled workers, just not doctors, nurses and technicians, but also paramedics and managerial staff to manage different hospitals. Today, many nursing homes are closing down is because you don't have that kind of skilled people to run it. So skill is one area this industry is in dire need of. So healthcare industry needs a lot of skill development.
And so basically, an employee satisfaction, motivation and skill development are the biggest challenges.
Biggest challenge, very, very big challenge. And because this industry is something which you being upgraded at every month. Today one machine comes, tomorrow the doctor wants another machine. The other hospital buys another high-end machine, my doctor is demotivated because the other hospital has bought it. So keeping them motivated, keeping them on their toes, and also there is one thing which needs to be remembered is that the doctors come in the middle of the night, the nurses are in the middle of the night, we do 24/7 shifts. You as a media house, you also must be doing 24/7 shifts. But when the entire emergency is full of patients NOK shouting, wanting to save the patient, just think of the nerve of the doctor who is attending to the patient. So that motivation level is a very big challenge which as a head, as a leader, which constantly we need to face.
Ma'am, the next question that I want to ask you is related to the previous question. How do you motivate your employees? What I mean is, how do you improve the operation process of hospitals effectively and efficiently?
So what I would like to say is that we divide it into two parts. One is reward and recognition. Reward and recognition is, there are certain areas how we look into it. One is when a customer comes and mentions about the particular employee, about how they have helped the patient to improve. We put the photograph as well as the comment, and we have something called a Hall of Fame which is kept on the lobby so that they feel motivated. Second, we have a R&R program which is done by the HR and all the departmental heads. They select a person who we want to reward in every department. There are outsourced employees who are the hospitality, who are security. We give them rewards separately. The doctors are given rewards. In fact, there is also a best dressed employee, or there is also a best dressed female. There is a reward for, the newly joined who is like just joined for 3 months, there is a reward for that. Now, apart from that, we also have something called clinical excellence reward. Like when we take patient safety round, we call this a patient safety round. During the audit round, we find that there are a lot of sisters, lot of people, lot of doctors, lot of RMOs, they follow a lot of protocols. They are following the hand wash protocol, they are following the infection control protocol. We give them instant rewards there also. So this is one part of motivation. Now the second part of motivation is where you need to build up the practice of the doctor. Now in AMRI, which is again a group vision, where we build up the practice of a doctor. Suppose a doctor has joined us, we don't expect him to do the marketing. We do the marketing from them. The branding, the clinical excellence which he is an expert in. Like we've got a doctor who is an expert in spine surgeries or a particular kind of a spine surgery. Now to promote him, to ensure he gets the right exposure, we do a full strategy program on that. And that is how we build up their practice. So in this hospital, you will see that a lot of doctors have actually built up their practice over the years. And today also, when the second line doctors are joining us, we've got a lot of good doctors from outside who are of our state, of Odisha state, who have come here. They have built slowly their practice and they are very good in their clinical expertise. So that is again another area of motivation. For example, a testimonial. A patient who has got cured out of a very difficult surgery, the testimonial of the patient is the motivation for the doctor. So we put the testimonials in FB and Instagram and the doctor feels much motivated. So these are the things which we keep doing.
And the next question that I want to ask you is out of curiosity, ma'am. how important is it for a doctor to get emotionally attached with his or her patient?
Every doctor is very emotionally attached, and I would like to tell you very honestly that the picture which is portrayed outside, that कि doctor ने doctor की negligence में patient मर गया. Believe me, the doctor gives each and every bit of his energy to save the patient. So death rate, there is something called, good hospitals always mark their death rate. Death on the table, which is in the OT, we call it DOT. So any doctor whose patient dies, believe me, he or she is never happy with it. There is always this thing ki bacha nahi saka. So I have been in this industry for 20 years and I've never seen a doctor being not bothered that the patient has gone. So every doctor is attached to the patient, and it's a challenge for them when they save. We have a patient who was there for us for almost 160 days and she was in a deathbed and she was saved. So you should have seen the clinician the day the patient got discharged. He was more happy than probably her family members.
Ma'am, I know it's a huge segment, but can you briefly explain us how exactly does the administration of a hospital functions?
So I gave a class in XIMB once about hospital administration and it took me 2 hours to explain it to them. So hospital administration has become a very technical subject. Today AIMS is also giving MD degrees in hospital administration. It has become a very defined and a technical area. Now there are 2 parts of hospital administration. One part is which you call it a clinical excellence, where clinically you are a good hospital. Clinically your outcome is good, your death rate is the bare minimum, your infection control are managed, your emergency is treated on time. This is one area of clinical excellence. The other area is the non-clinical part, which comes in your upkeep of the hospital, cleaning of the hospital, maintenance of the hospital, finances and front office of the hospital. Apart from this, there is one side where we call it return of investment. This is not applicable to government hospitals because government is funding them.
Correct.
Now, this finance part is where you have to make the hospital viable. Hospital is a huge investment and a huge manpower investment, right? So you have to make the hospital viable. Hospital viable doesn't mean just go on increasing prices. Hospital viability also includes which facility you will bring in, when you will bring in. Maybe I have a 400-bed hospital, but I will only open 50. I will make something, then open 100. So the balance between the clinical outcome as well as the non-clinical outcome as well as the financial balancing is what the entire hospital administration and management does. Because a doctor cannot get into that. The doctor will just treat the patient. But which doctor will do what surgery and how much of machine should I buy for that doctor and how many beds should I keep for that specialty is the hospital administrator's job.
Let's talk about COVID-19 pandemic. I mean, what has been the impact of COVID-19 pandemic on hospitals, especially as far as business is concerned? Because as much as I understand, the business must have got better with the COVID-19 pandemic coming in. What do you have to say, ma'am?
So if you ask me, hospital business is concerned, it is not a very positive impact because in our state, Odisha government did a very good thing was that they made it into packages. So we did not, I wouldn't say the word fleece, but we did not actually, unnecessarily charge the patient, but everything was very structured. Okay. So as administrators, it was very easy for us, and as patients, it was easy for the patient. So I would really appreciate that the government worked very closely with the packages. Viability of earning, yes, we were the only industry which was earning, honestly. Other industries were in a bad state. But there was a time where we did not earn and we had to cut down salaries. because we were literally, we were not even having any patients because our non-COVID patients did not come, right? Our surgeries became bare minimum. So we did not earn for 3-4 months and we had to curtail our salaries. Now, COVID is also a lot of expenditure. COVID is also like you have to have a separate AC duct, you have to have Verons, PPE, gloves. At that time when it started, each and every mask was 400-500 rupees, yes, which came down to 19 rupees later, but we had to buy it at that price, right? So financially, I wouldn't say we benefited much. We had to bring in a lot of losses because of the operating cost. The operating cost shot up like crazy. Remdesivir, medicine and everything, and though government supported us in a major way, but there were crises. Now financially, okay, we balanced it. The second wave was different. Now what taught us? First thing I would like to say is that during the COVID, I think we all got blessed. We got blessed from everybody you can think of, because we were the only industry which was working 24/7, not even bothered about our own lives. And I remember how frantically people used to call me for bed. And till date, those who I have helped during that time, believe me, till date they call me and say that आपने COVID के time में हमको इतना help किया. So I guess that is the blessing we have got as an industry. As an industry, what we learned was that no matter you have the best of equipments, you have the best of money, you have the best of infrastructure, you have to be equipped for every hardship. So when the first wave crossed, we crossed the first wave, we were more or less confident that yes, we will be able to manage COVID, And at that time, we had opened only 150 bed COVID because our government had already had COVID hospitals and isolation centers and everything. Now, when the second wave came, believe me, I just opened, I think, 250 beds with ICU of 102 ICUs within 24 hours. And there was a time where I had to make decisions that where will I get doctors? Because my 3 clinicians who were there for pulmonology, which is lungs, one after the other, they were affected with COVID. So my anesthesia team, my entire other junior doctors team, they all stood by. And we opened 250 beds COVID, and the second wave was something which we could not even think of. The second wave was we saw the young generation going away. We saw them, if we put them into ventilators, they were deteriorating. It was a puzzle every single day. But our hospital, our critical care team did a commendable job here. And critical care team was very good here. And what we faced as administration was that 24/7 we were at our toes. There was a lot of media pressure, a lot of government pressure, a lot of answerable things, a lot of VIPs getting admitted. The worst part was that the patients NOK couldn't meet them, and the patients couldn't meet anybody. So, the depression used to set in with COVID, where the patients used to not cope up with the loneliness. So it was a real learning experience for us. Real learning.
Physical, it was more of a mental health.
Lot of mental health, and then you see families wiping out in front of you. You see the father is admitted, mother has died, the child is standing outside in the corridor. Who do you counsel? What do you tell them? So there are instances also. And as well as I would like to mention this very funny story, there are instances also you come to realize that how close a person is, where the son does not even come into the hospital to sign the father's consent, and also tells us that if you have any association for my father's funeral, please do the funeral. I don't want to come. So you come to know a lot of hard realities during COVID, and I think it was a learning experience.
Ma'am, it's been less than a decade since AMRI hospital was established in Bhubaneswar, and within a very short span of time, the hospital has seen tremendous success. The word of mouth has been extremely positive, and the goodwill is quite amazing. Ma'am, why do you think this hospital has been successful so far?
Service. Customer service is the mantra. It is always a belief, if your leader believes in a service industry that customer is first, you will always grow. There is one mantra which is customer service, and the second mantra, which I will be very proudly saying, is we are an open book, because we don't have any unethical practices going on. We don't have any targets set to us. We don't give any targets to our doctors, because our promoters always believed that this is more of a CSR kind of a thing. It was never a profit making. Sustainability is a question, right? But actually, if you ask me, I am there in this hospital from 2015, where it was hardly 30 beds, right? Today we have 400 licensed beds, and we have grown almost 128%. The growth has been commendable is because we have been very loyal to the doctors. We are clean with the doctors. The doctors are extremely supportive with us, and we have tried to give the best of services. Today, if there is a customer complaint, I will not say that my hospital is 100% customer compliant. No. There is no administrator in this entire world who will say that the hospital does not have a customer complaint. But I learn from customer complaint. We learn from customer complaint. So the more you learn, that is the mantra. So AMRI Bhubaneswar's success is operations, is actually medical and non-medical operations, if you ask me.
Operations and transparency at the same time.
Operations and transparency, like today, if my doctor has done something good, he is recognized. If there are two other doctors in the same specialty, they are joined, they are made a team. There are hospitals where doctors don't even look at each other. But here we don't have that issue. Believe me, the doctors are much more of a team and much more of a family. So our success has been that. It's honestly been that. Today, there are a lot of big national brands competing with us. But when I walk into the government, when I walk into any kind of a sector, when I walk into the secretariat, I walk into any office, the only one word which we hear is, "Ame thore phone karle sabu hei jauchi." That is it. So your work is done. So that is the mantra.
Ma'am, we all know that you have been into this field of hospitality since quite some time now. What I want to understand, what I want to know is, how did you get associated with Indian Chamber of Commerce and Association for Healthcare Providers in India?
So when I came to Odisha, I did not know a soul. I didn't know anybody. I started working here. I had come from Delhi. I was with Apollo Enterprise there. I came from there. And with work, with slowly interacting, when I met in the social gatherings, there AMRI did not have any brand in 2015. It was an extremely new hospital. Khandagiri was an area where we had a van at the Khandagiri junction to bring patients, because there was no Ola Uber which used to come inside. So that is where we started. Now, how I got inclined is, when anybody I met wanted to take the services, I made sure that the services were given at the topmost level. So slowly I met a lot of industrialists, a lot of very renowned people who were attached to the Indian Chamber of Commerce. Once in a lot of gatherings where I have commented on the industry, where I have given certain perspectives of the industry, where Mr. J.B. Pani, who is right now the president of ICC, he gave me an offer 4 years back that why don't you become a health committee member. So from a health committee member, I joined as a health committee member. From there, they made me the convener this year. So I became a convener. So it is out of total sheer hard work, honest work and diligent work that I got my recognition. Then AHPI, Association of Healthcare Providers of India, this is a body which is an all India body with the private healthcare system. That includes your small dental clinics to everything. The president is Dr. Girdhar Gyani and Dr. Alec Thomas. Dr. Naresh Trehan is one of the key members, Dr. Devi Shetty. So when they wanted to work in Odisha, they asked somebody in the eastern zone in Calcutta ki, we want a dynamic person in Odisha to work. So my name was recommended. So probably I got my recognition out of hard work, and today I am the Odisha State Chapter Secretary here, and Dr. Deepak Mitra, Some Hospital, he is the President. AHPI has worked very closely with COVID, and we came to know from every state what is happening in other states through the HPI forum. And I would like to mention that our state was one of the best managed states during COVID. If I get all the feedbacks from other states, we really managed very well. And our government, the bureaucracy, the bureaucrats were extremely helpful during the COVID-19. So this is how I got my recognition. So today I have HPI, I have ICC, I have CII, I have whole lot of things in my kitty today.
Ma'am, you have also been honored with the prestigious Times Power Woman Award for upholding a pivotal role during COVID-19 pandemic. Can you share some of your experience during the pandemic?
You know, it is a very personal thing I would like to share, is that when COVID started, there was fear everywhere. And I was just living with my daughter here. She had come from Bombay and she was staying there. Every evening when I used to go back dog tired, I didn't know that tomorrow I will have COVID or not. Now that time anybody had COVID was almost 15 days in quarantine, 21 days to start with. One after the other, the employees fell sick. Taking decisions was something which I had to take. There was nobody beside me to take decisions. Government was coming up with rules because government themselves didn't know what was happening the next month, what is going to happen. But one thing I made sure was minimum refusal. I had the entire team functioning, and I would like to say that my entire marketing team helped the operations to ensure that we don't refuse any COVID patient. Now there were a lot of panic which had happened, people were just having fever and cough and they were thinking COVID. So saturation, there were people who were coming with 99 saturation but wanted to get admitted. We filtered those out. We admitted patients only with 75 saturation and those who really needed. Now this entire journey of helping each and everybody irrespective of any place they are coming from. My phone used to be on 24/7, 4 in the night. There used to be people shouting at me, nobody is come and given medicine to the patient. But that time one doctor was taking care of 30 patients. There was no doctors. Doctors were running, and can you imagine wearing PP 24/7? It was crazy. So maybe because I was always approachable to everybody. That's what they mentioned when they gave me the award, that she was always there for everybody. That is where I earned my forte. I got my forte and my recognition, that I was there for everybody, whether it was anybody who called me in the night. I tried to help them as much as possible, whether it was remdesivir, whether it was oxygen cylinder, or whether it was bed. So that is why probably I got it. And I did not get COVID also in the next 2 years. How I survived, I don't know. But I was not affected by COVID in the second wave also, in the first wave also. So end of the day.
You haven't had COVID till now?
No. So I got vaccinated, and every time everybody used to say, Madam, COVID test apna korchunti? I said, I wish one day of holiday I will get if I get COVID. So that was the journey.
And the last question that I want to ask you is, woman leadership in Bhubaneswar, in Odisha, is rare, and you have been a very successful leader. I mean, what I want to understand is, what's your future ambition, ma'am? What's next for you? Because in your little kitty bag, you have had a lot of success. What's next for you, ma'am?
What's next? As a woman, it has been a very, very long journey for me. Personally also, I had to fight a lot of battles to come here. As a woman, to establish myself has been a big difficult task here, because yes, you're very right. In Odisha, in Bhubaneswar, there are still women who need that kind of a platform to come into that level. So people believed in me pretty late. But I think my honesty and my hard work is where I am today. One thing I make sure, that any woman who works in this organization has their head held high. There is no woman who feels that they can't walk into my room and ask for any help. Way forward, I would I would love to go into an institute where I try to educate them about the healthcare system, because what the management institutes are teaching and what is actually in practicality is very different. So that is my ambition. I'm not a very ambitious person. I'm very content with the place I am, and I think my forte and my success, with due respect, is because I belong to an industry where people need me at their crisis time. So I get a lot of blessings from them. So it is their blessings that I'm sitting here today. So my parents and my blessings of everybody. Just before I end, I will tell you a small story. That there was a boy of 14 years old who was suffering from pancreatitis here. His elder brother had passed away with pancreatitis. So one day a man walks into my room, his father, wearing a dhoti kurta, absolutely old and frail, saying that please save my second son. So at that time, this was in 2017, at that time we knew that he could not afford our expenditure. So I spoke to some other hospital in Hyderabad, which is a very good gastro hospital, spoke to a consultant here, and we shifted this boy there. And I told my promoters that we will waive off the thing. So that was okay. So this boy got shifted, and after 3.5 months, I see that man again walking into my chamber with a small felt outing of Lord Jagannath. He was a bangle seller in Cuttack, and he came and gave me that small felt thing of Jagannath, said, I've made it with my own hands, my son is saved because of you. So that is what is the success of today. This industry, we are blessed with a lot of things. So I guess my success story is that.
It was an absolute pleasure having a conversation with you, ma'am. After having a conversation with you, I personally feel so motivated. Thank you very much, ma'am, for having a conversation, for talking to Swasthya Sambad. Thank you, ma'am.
Thank you very much.